When I have an order to administer an IV push medication, you would think that the IV push rate would be part of that order. That's not generally the case. What I have to do as the registered nurse or whoever's pushing the medication is make sure that I've looked up what is a safe push rate using a drug book, an online source that's reputable, or even contacting my pharmacy. And then once I figure out what the correct and safe push rate is, I can administer my IV push at that rate. What I think sometimes can be hard to imagine is how long that time feels when I'm in the actual scenario. Because when I'm thinking, 30 seconds, or it's only 2 minutes, that doesn't feel like a long time right now. But when I'm standing with someone and watching medication go into the tube, it feels like such a long time. It also can feel really difficult to make sure that I'm consistently administering medication over that period of time. So what I like to do is break it up into pieces. I have 1 milliliter of medication in this syringe. If my order is to administer that over 1 minute, then I like to break it into smaller increments. So if 1 milliliter goes in over 1 minute, then over 30 seconds, I should be pushing 0.5 milliliters, right? And over 15 seconds, I should be pushing 0.25 milliliters. And that, for me, is a lot easier for my brain to track. If every 15 seconds, I'm making sure that 0.25 of my milliliter is being injected. So it's easier for me to keep it at a correct rate or pace instead of kind of going in spurts. And one final thing about IV push, I'm going to follow this medication up with a saline flush, and that flush should be administered at the same rate so that the medication that is remaining in this extension tubing is still being inserted at the correct rate.